Hello, my name is Ariane Buenrostro and I will be reading Unit 4, Professional English in Use Medicine, chapters 24 to 33. Chapter 24, Infections, Fever. A medical student has made some language notes on a case report. Case 45. A 24 years old man presented with a fever which he had had for 3 days. On the third day, he had had a severe attack of fever with sweating and rigors. The only past history of relevance was hepatitis 4 years earlier and glandular fever infection with Epstein-Barr virus at the age of 18 years. 18 years. He had returned from Africa 3 weeks previously. Fever, pyrexia. Also, also remember PO, pyrexia of unknown origin. Fever, also known as temperature. I've got a temperature. Feverish, febrile, and pyrexial. Afebrile, apyrexial. Some symptoms of fever: sweating, rigors, chill. Microorganisms. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms such as viruses or bacteria that can usually be identified, thus establishing the etiology early in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable. Communicability is another factor which differentiates infection from non-infectious diseases. Transmission of transmission of pathogenic organisms to other people may lead to an outbreak or epidemic. Finally, many infections are preventable by hygienic measures, vaccine or drug prophylaxis. Microorganisms include bacteria, viruses, fungi, protozoa, patient microbes. Another word from these pathogens is microbes. Patients often call them germs, or bugs. Common expression. Common expression. Could he have got some disease from the dog? I think I've got the flu bug that's going round. Source and spread of infection. Infection may originate from the patient endogenous or from outside sources exogenous. Carriers may be healthy and may harbor organisms in throat, bowel, or blood. Non-human sources include water, milk, food, animals, birds, and soil. The incubation period is the time between infection and first symptom. The period of infectivity is the time the patient can infect others. 24.1 match the two parts of the sentences. Look at A, B, and C opposite to help you. One day. 1988, so the UK launch of live attenuated measles, mumps, and rubella MMR vaccine. 2, 2E. Chickenpox varicella is a common infectious disease of childhood. 3A. Rabies has an incubation period ranging from 4 days to many months. 40H. The patient remained febrile with peaks of temperature of 39.5 degrees C. 5B. He was admitted with a for the history of influenza-type symptoms of fever with rigors, myalgia, and general malaise. 6C. Quite a proportion of patients who recover from hepatitis B become carriers of the virus. 7F. The central part of Africa is in the midst of an epidemic of AIDS. AD. Measles rubella is most infectious during the catarrhal stage. 9G. Lyme disease is caused by transmission of B. burgdorferi from animals to man by exotic ticks. 10I. PUO stands for pyrexia of unknown origin. Complete the case report on the patient in A opposite. Look at A, B, and C opposite to help you. Case 45. On examination, he looked unwell. His pulse rate was 100 per minute. He had a palpable spleen. Palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 40 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasite in his blood film. Complete the sentences. Look at A, B, and C opposite to help you. Infection with can be treated successfully with antibiotic is curable. Another word for an epidemic is outbreak. Bacteria and viruses are examples for microorganisms. Or someone whose temperature is normal is afebrile. The common infection with Epstein virus is known as glandular fever. Over to you. Cases of HIV infection reach record high in the UK. Describe the situation with regard to HIV in your country. What measures are being taken to control it? In the Dominican Republic, HIV is still a public health concern, but infection rates have been gradually decreasing. The country is responding with free testing, access to treatment, education campaigns and prevention programs to reduce new cases. Now, in Spanish, infecciones, fiebre. Un estudiante de medicina ha tomado algunas notas de idioma en un caso de gripe. Caso 45. Un hombre de 24 años presentó fiebre que había tenido durante 3 días. Al tercer día tuvo un ataque severo de fiebre con sudoración y escalofríos. Los únicos antecedentes relevantes fueron hepatitis 4 años antes y mononucleosis infecciosa, infección por virus de Epstein-Barr. A la edad de 18 años, había regresado de África 3 semanas antes. Fiebre, pirexia, pirexia, la PUO, pirexia de origen desconocido, fiebre, también conocida como temperatura. Adjetivos: fiebre, vida, opuestos a febrile, pyrexia. Algunos síntomas de fiebre: sudoración, escalofríos, escalofrío intensos y sensación de escalofríos, también conocidos como escalofríos. Parte B. Microorganismos. Las infecciones difieren de otras enfermedades en varios aspectos. Los más importantes es que son causadas por microorganismos vivos como virus o bacterias que generalmente se pueden identificar, estableciendo así la etiología en una etapa temprana de la enfermedad. Muchos de estos organismos, incluidos todas las bacterias, son sensibles a los antibióticos y la mayoría de las infecciones son potencialmente curables, a diferencia de muchas enfermedades degenerativas y crónicas no infecciosas. La transmisibilidad es otro factor que diferencia las infecciones de las enfermedades no infecciosas. La transmisión de organismos patógenos a otras personas directa o indirectamente puede provocar un brote o una epidemia. Finalmente, muchas infecciones se pueden prevenir mediante medidas higiénicas, vacunas, especialmente vacunas vivas atenuadas como la vacuna contra la rubiola, o profilaxis farmacológica, por ejemplo, cloroquina para prevenir la malaria. Los microorganismos incluyen bacterias, virus, hongos y protozoos, como el parásito que causa la malaria. Otra palabra general para estos patógenos es microbios. Los pacientes a menudo se refieren a los microbios como gérmenes o bichos. Observa las expresiones comunes para contraer una enfermedad infecciosa. ¿Podría haber contraído alguna enfermedad del perro? Creo que me he contagiado de la gripe que anda por ahí. Parte C. Origen y propagación de la infección. Aquí tienes un extracto de un libro de texto de medicina. La infección puede originarse en el paciente endógena, generalmente de la piel, la nasofaringe o el intestino, o de fuentes externas, exógenas. A menudo, otra persona que puede estar sufriendo una infección o ser portadora de un microorganismo patógeno. Los portadores suelen estar sanos y pueden albergar el organismo en la garganta, por ejemplo, difteria, el intestino, salmonela o la sangre, hepatitis B o VIH. Las fuentes de infección no humanas incluyen el agua, cólera, la leche, tuberculosis, los alimentos, botulismo, los animales, por ejemplo, rabia de las aves, citacosis y también el suelo, legionela. El periodo de incubación es el periodo entre la invasión de los tejidos por patógenos y la aparición de las características clínicas de la infección. El periodo de infectividad es el tiempo en el que el paciente es infeccioso para los demás. Gracias.